Sure, sure. So some background, right now, as I'm sure many folks know, Louisiana ranks pretty low on a lot of national health rankings, and we have a large uninsured population. 1 in 4 adults in the state don't have health insurance, and we know that when people don't have health insurance, it makes it harder to see a doctor, it makes it harder to manage a chronic disease like diabetes, and it leaves people open to a lot of financial risk if they do get sick and incur high medical bills. So the Affordable Care Act, or Obamacare, some people call it, to deal with the problem of the uninsured, there was kind of two strategies. One was for moderate income people to get new tax credits to buy insurance, but for lower income people, the plan was to expand state Medicaid programs. But right now, Louisiana has one of the lowest eligibility limits for Medicaid in the entire country. So we do a pretty good job making sure that children have access to health care. We do a good job for people with disabilities. But for adults, most of whom, working adults, the limits are so low that if you have a job, it's basically impossible to qualify because you make too much money. So the Medicaid expansion would raise that low limit up to 138% of the poverty line, which for a single worker is about $15,000 a year. For a family of 3, it's about $20,000. So not a huge amount of money for a lot of people, but we know in our state, it's a low-wage state. A lot of folks are working low-wage jobs in the service sector where they're making, $8, $9, $10 an hour. And this Medicaid expansion is really aimed at that population to make sure they can have access to health care.
Okay, so let me just get some groundwork out the way, and that is that the ACA, as designed before the Supreme Court had ruled one part of it, struck down one part of it. Basically, the Affordable Care Act was compelled all the states to opt in, or not even to opt in, but to expand Medicaid in their states. Am I correct about that?
Yeah. So originally the Medicaid expansion was going to be mandatory, and all 50 states were going to have to do it. But you're right. The Supreme Court said that's not okay. You have to make the Medicaid expansion optional for states. And Louisiana was one of, about half the states who decided to opt out, which, here at the Budget Project, we've looked at the policy of this, and we think that's the wrong decision, that by opting out, we're going to be, hurting a lot of people and leaving a lot of federal money on the table. And it's going to set up this very odd dynamic where, folks who are maybe making a middle income are going to be able to get these great tax credits to buy health insurance, but the folks who are, low-wage working poor are going to get nothing and are going to be locked out and left out of health reform. And, we don't think that's a good move for our state.
Okay, thank you. So, as I understand what you're saying, those people who are, just like you said, making minimum wage or poor, just haven't really made it in life, or working 1, 2 jobs, whatever it may be, those people who are not making 138%, okay, of the poverty level, the federal poverty level, they do not, if they don't already qualify for Medicaid, they cannot get Medicaid because the state has not expanded. Is that the way it works?
Right, and right now the limit, the income limit for Medicaid, if you're just an able-bodied adult, is very low. It's about 15% of the poverty line. So, to put that in dollar terms, for a family of 3, that's $3,000 or $4,000 a year in income. So basically, anybody that has even a part-time job would be above that limit. And that limit is also only for people with children. So if you're a childless adult, either you've never had kids or your kids are out of the house and grown adults, those people can't qualify at all, even if they have 0 income. So it's very hard to qualify for Medicaid in this state as an adult, and that's one of the reasons that we have one of the highest uninsured populations in the entire country. Is there's just this big kind of gap in the system, and that's what Medicaid expansion, it's supposed to close that gap and make sure that no matter what your income is, as you fluctuate through life, maybe you get a raise, maybe you lose your job, it doesn't matter. Wherever you are there on the income scale, you'll have some access. But this is not expanding Medicaid leaves this huge gap for a lot of people. And we've estimated that the Medicaid expansion, if we did it here in Louisiana, could help up to 400,000 people. So this is a huge population. We're not talking about small potatoes here.
Okay. And so what is the population altogether that has been estimated that will be in that gap?
So yeah, we think that if Medicaid were expanded, as many as 400,000 people could access healthcare through Medicaid expansion. So without Medicaid expansion, some of those people are going to be able to enroll in other health plans and maybe get tax credits. But the majority of those people without Medicaid expansion will likely remain uninsured and have to be reliant on charity care and